Let's move on then. No more preambles now. Let's go to Calgary Fish Creek.
Thank you, Mr. Speaker. Despite an annual management budget of over $400 million, AHS spends $460,000 every single day on additional consulting contracts. That's 38 daily hip surgeries that could have been funded but weren't. That's 14 daily bypass surgeries. That's 42 daily knee replacements. Instead, the government chose to spend almost $30,000 on an AHS image and reputation strategy report. Well, Minister, I'm going to give you some free advice. If you want to improve the image and reputation of Alberta Health Services, fund surgery, not consultants. When are you going to start?
Mr. Speaker, just to be clear about the information that was obtained by the opposition, in an 18-month period, Alberta Health Services spent $250 million on consulting services, the lion's share of which were related to the establishment of AHS and the consolidation of systems in the 9 former health regions. Mr. Speaker, today Alberta Health Services, as of December 31st, was spending about $48 million on contracted services. Now, Mr. Speaker, I would be the first to question the same contract that the honourable member just mentioned. As she knows, that contract was let by the former board, and the contract was subsequently cancelled.
First supplemental.
Wow. Mr. Speaker, I honestly do not know what to say. From 12 to 13, Minister, not 6 years ago.
Here.
Given that AHS policy on consultant engagement lays out very specific terms and rules on how contracts are to be awarded, who they can be awarded to, and the tendering process that must be followed, can the Minister assure this House that all $250 million worth of consulting contracts followed these rules and were above board in the eyes of Albertans? And I caution you, Minister, how you answer this one.
Well, Mr. Speaker, the caution that is needed is to the honourable member and her colleagues about how they ask these questions. Because, Mr. Speaker, what they presented earlier today is a news release to now raise in this House as a question of adherence to established policies and procedures with respect to the awarding of contracts is a gross misuse of the information that was obtained under the Freedom of Information, Privacy and Protection Act. This honourable member knows, Mr. Speaker, that there are appropriate places to go within the Legislative Assembly and its committees to ask these sorts of detailed questions. I challenge her to present those questions to the Public Accounts Committee, to have them answered in public.
And to final supplemental.
They don't answer the questions there either, Minister.
Here.
Given that last week we learned that outside of AHS, this government already employs over 14 communication staff and an annual cost of $23 million, will the Minister of Health perhaps consider lending one of those 16 comm staffs his ministry employs the next time AHS needs help spinning the government's bad news of the day?
I have no idea what that question was intended to elicit. So I'll take the opportunity, Mr. Speaker, as the Premier did in answer to an earlier question, to remind the honourable member that those communications officers within the Public Affairs Bureau that also work within our departments and within agencies like AHS are there for the purpose of providing information to Albertans about how to access the programs and services that matter to them. If this honourable member doesn't think that those services provided during the flood in her constituency or in other times when Albertans were in need are not worthwhile, then I challenge her to tell that to the members of the public.